So we're going to use the Primera by Chattanooga here to apply TENS to our knee that is painful after surgery. And we're going to have it set up, the electrodes set up slightly differently than what is in the manual. And I'll explain rationale here in a moment. So what they've shown is that a combination of TENS application as well as cryotherapy, that is cold therapy, immediately before a training session can help to improve the quadriceps activation, because it dulls the pain and the swelling at the joint level, which is actually causing the inhibition of the muscle. So this is the ideal time to do it. You have like a therapeutic window of 45 to 60 minutes after your icing, where this is going to allow you to better activate your quadricep. And you can use the same device to engage your quadricep. See the previous video shown. You can certainly do this at other times of the day, even after your training, if you just want to, for pain modulation, by all means. But it is, again, most therapeutic for a better quadricep and a more effective training session if done immediately before, that is anywhere between 45 and 60 minutes before. Okay, so when we open up the manual on page 27, it shows us where we may want to, again, it says suggested general electrode placement, right? And we're going to be a little bit more specific. So give me one moment to flip open to the page here. So for the quadriceps, we already we already gone through this, and we place the plaids up onto the muscle itself. But for the knee joint and for the pain modulation effect that we're trying to induce, it's going to be different. We want to kind of surround the joint, if you will, and we're going to use a kind of more of an interferential current by going positive, negative, positive, negative. So it's going to be a kind of a cross current rather than having the same channel on either side. And I'll explain more in a moment. Okay, so here we go. So it actually doesn't matter whether the positive and negative is on the bottom, as long as the same channel is across from one another, so that it's crossing the knee joint. And then we're going to use, there's multiple programs built into the Chattanooga Primera device. What we're going to use is going to be program number 2, which is one of the TENS units, or 10 program. And we can, if you open up the manual again, it will show you all the different programs described, and that's on page 18. Program 2, we like it because it's the continuous stimulation. The hertz rate's a little bit higher than P1, and then same with the pulse width. That's also, again, it's somewhat comparable to P1, but really the differential between them is going to be the hertz, and then also the duration of time. We only need to be icing for 20 to 30 minutes or so. You don't need to be icing for a full hour. Okay, so great. So you're going to go ahead and turn on your device by hitting your power button. We left off doing our NMES, so it's automatically going to find itself on P9, and you're going to hit the program button and toggle that until it says P2 again. And then once it hits P13, it's going to cycle back. There you go. All right, and then this is going to be a different experience. It's not going to be an uncomfortable one. It's going to feel like buzzing or ants crawling on your knee. And so you're going to hit the positive on both channels, because we're using both channel A and B, and you're just going to ramp this up as high as you can. Okay, and really you want it to get it to a point where it's almost feeling like your knee's asleep, right? Where you get that almost like you have to shake your hand out after you've slept on your arm for too long. And then you want to get it to the point where that's predominantly the sensation that you feel in the knee. And again, the cryotherapy, the cold therapy on top of this will help to further reinforce